how are you today?
I'm good, how are you?
Good. Would you state your name and position for the company?
Yeah, my name is Jill Traver, and I'm a physical therapist for Ability Rehabilitation and the clinic manager of our downtown location.
Okay. We've had various students do their practicum component at Ability Rehab. Can you just give us a little bit of your take and your experience with the program?
Overall, the experience has been very good. I think it's for the therapist as well as for the students. We've had a really good relationship. For us, it's nice to get the perspective of what the training is in other countries and to see how therapy here differs from other places, as well as I hope we've been able to provide a very good learning environment for the students that have come our way, and again show them the differences that we do in our company as well as just in the U.S. compared to what they might be seeing in other places, and expose them hopefully to a variety of techniques as well as go through a complete program with them, showing what happens from the evaluation throughout the treatment sessions and then how we get patients to the point of discharge.
Okay, great. Was there a particular student that you remember from your experience here?
Yeah, we had a recent student whose name was Daniel, and he was absolutely fabulous. Everybody in the clinic loved him, from the patients to the staff and all of those types of things. He was very interactive, he was wonderful to work with, and just seemed to absorb anything that we told him throughout the experience. Always very prompt, very professional, all of those kinds of things. It was a very good experience for all of us.
Great. What are some of the things that you would like the students to be prepared for before coming to Ability?
I think as far as being in healthcare, one of the things that's sometimes different if you're not maybe doing this in your first language, to understand that always communicating can happen in other ways. So you can communicate by looking at an anatomy book or pointing to the structure maybe on a patient or on an anatomical model, versus necessarily having to worry if you don't necessarily know the language. Especially when it comes to patients, they don't usually know medical language either. So finding those different ways to communicate can be very valuable. And I think for us to just know kind of the skills and the knowledge base that the student has had before they're coming to their experience.
Great. Thank you so much for your time, Jill.
You're welcome.